Hello everybody, we're here today to share dramatic new information that will shine a spotlight on the health impacts of tar sands oil. Health impacts that are already being felt in communities exposed to one of the filthiest kinds of oil on our planet. The Keystone XL pipeline will allow 830,000 barrels of tar sands oil every day to flow through our nation, an initial increase of 45% compared to what is being imported today. And this project could be just the beginning. In the long term, it is projected that Canada would produce almost 300% more tar sands oil by 2030. I believe, and I know I speak for Senator Whitehouse, and he will speak for himself as well, that the health impacts of tar sands oil are being ignored. Last month, the State Department released the final environmental impact statement for the Keystone XL pipeline, and it lays out some of the reasons why the pipeline would worsen climate change, including that operation of the pipeline would be the equivalent of adding 300,000 more cars on our roads each year. But the EIS was woefully inadequate when it came to exploring the human health impacts of the pipeline. Today, we will connect the dots with some incredible people here who you will meet between health risks and tar sands oil. We will hear from people about how their communities have been or would be harmed along each step of the toxic tar sands oil process, from the extraction to the transport to the refining to the waste disposal. Dr. John O'Connor, would you raise your hand, John, please? Dr. O'Connor, a doctor in Alberta, Canada, will talk about how his patients have been impacted by tar sands extraction. Just 2 months ago, a man named John Chatti was diagnosed with an extremely rare and incurable cancer of the bile duct. This is a tragic situation for John and his family, but it's also very frightening for his community, which is located downstream from a major tar sands extraction site in Alberta. There are other cases in Fort Chipewyan of this extremely rare type of cancer, and several other suspected cases over the past decade. The rate for this cancer is 30% higher than average in Fort Chipewyan, where elevated levels of carcinogens and mercury have been documented. After tar sands are extracted, they must be processed, and a refinery stage also poses health risks. Dr. Stuart Batterman, Dr. Batterman, will you raise your hand? A professor from the University of Michigan will tell us about his research, which found significantly higher levels of dangerous air pollutants and carcinogens downwind from a tar sands refinery near Edmonton, Alberta. He will explain how in the areas where elevated levels have been reported, people are suffering higher rates of this type of cancer linked to those toxic chemicals, including leukemia and non-Hodgkin's lymphoma. We need to clearly understand that as tar sands oil flows to our Gulf Coast refineries, it will increase toxic pollution that already plagues communities like Port Arthur, Texas, which is near many refineries that will process tar sands. And we will hear from Hilton Kelley. Hilton, could you raise your hand? A community representative who is a prize-winning environmentalist. Port Arthur is on the EPA's list of sites with dangerous ozone levels, and its residents suffer now from asthma, respiratory ailments, skin irritations, and cancer. Tar sands will add another threat to Port Arthur and other communities that are already in distress, as you will hear. To get to the Gulf Coast, tar sands will be transported by pipeline through communities in environmentally sensitive areas in 6 states. We know from experience how harmful this can be because tar sands oil is very difficult to clean up when a spill does occur. In 2010, a pipeline ruptured and spilled over 1 million gallons of tar sands oil into the Kalamazoo River in Michigan. This was the largest inland oil spill in history, and more than 3 years later, it is still not cleaned up. One resident living near the Kalamazoo River had to abandon her home because of the stench from the spill. It made her feel dizzy and nauseous, classic signs of acute exposure to tar sands oil. Another resident who was pregnant reported having trouble breathing. Quote, "My eyes were burning, my nose was burning, it smelled like a diesel tanker had turned over in front of my house," unquote. Now, the final step in the tar sands chain is the disposal of waste byproduct that is produced when tar sands is refined into oil. It leaves behind petroleum coke, known as pet coke. And this is not like your favorite pet. It's a black dust containing concentrated heavy metals. Open piles of this waste began appearing at unprecedented levels in Midwestern communities last year, and it has sparked health and environmental concerns in many neighborhoods in Detroit and Chicago. We'll hear from Tom Shepard. Tom, will you raise your hand? About a Chicago neighborhood that experienced billowing clouds of black grit blowing off the mountains of pet coke. At a baseball field located a block away from one of the piles, Little League players were forced to quickly take cover. Take cover! According to one newspaper, the kids, quote, that were playing ball were sent scurrying away because the stuff was getting into their eyes and on their face and in their mouths and everything. They just had to get the heck out of here, unquote. Residents felt they could not safely open their windows during the summer for fear that the black clouds would trigger their children's asthma. And with good reason. We know this type of toxic air pollution can increase the number and severity of asthma attacks, cause or aggravate bronchitis, and contribute to other lung diseases. So I have shown you, or at least I have told you, how health miseries follow the tar sands. Health miseries follow the tar sands, from extraction to transport to refining to waste disposal. Many voices have weighed in on the Keystone XL pipeline, and I have said repeatedly that the pipeline is bad for the environment, will worsen the impacts of climate change, and will provide only 35 permanent jobs, according to the environmental impact statement. Last week, a state court in Nebraska found the state acted illegally in determining the route of the Keystone XL pipeline, and serious questions have been raised about a consulting firm that worked on the EIS and a potential conflict of interest because of its financial ties to TransCanada, the company seeking to build the pipeline. Clearly, much more needs to be done before any decision is made. Ultimately, the decision will be based on whether the XL pipeline is in the national interest. We need to slow this down long enough to get that question answered. So I ask today, how many more Americans with asthma will we see? And is that in the national interest? How are more Americans with cancer in the national interest? How is it in the national interest when kids playing baseball have to duck and cover from dangerous pollution? Children and families in the U.S. have a right to know now, before any decision to approve the Keystone tar sands pipeline is made, how it would affect their health. That is why today, Senator Whitehouse and I are writing to Secretary Kelley, asking that the Obama administration analyze the public health risks to our communities from the pipeline. I plan with Senator Whitehouse to send the testimony of these witnesses to the administration, and we are asking them to complete a comprehensive human health impact study and give the time necessary to analyze that question. Nothing less than the health of our families is at stake. It is my honor to present someone who is just a fierce fighter for the environment, and what an amazing addition he has been to this United States Senate. Senator Whitehouse. You don't need this.
Thank you, Chairman Boxer, for your leadership and for bringing these very important voices to Washington today, and to the witnesses who are here. Thank you so much. Many of you have traveled a long way and undertaken very significant inconvenience to be here to share what you know. It is extremely important that a decision as important as the Keystone XL pipeline be made by this country with our eyes wide open to the health effects, to the climate effects, and not just take as gospel parts of a report that was clearly written by a consultant with a significant affinity for the industry that wants the Keystone pipeline to proceed, and without the kind of regard that I think we need to have for the struggle ahead to recognize truly what carbon pollution is doing to our atmosphere and to our oceans. to the natural world that we inhabit, and to our people. If we continue in the status quo, we are in for a very rough ride. And the status quo is what we have to look beyond, and the Keystone Pipeline is a dangerous commitment to a status quo that is itself dangerous for all of us. So you're here to hear from the witnesses and not from me, so I will conclude my remarks there, but I'm very grateful to the folks who are here, and particularly to our witnesses for their trouble and for coming here to bear witness to what they know. Thank you.
Thank you.
Thank you, Senator. We're going to hear from Dr. John O'Connor. He's a doctor in Alberta, Canada. He will talk about how his patients have been impacted by tar sands extraction. Welcome, Doctor. Thank you.
Thank you very much. Good morning. My name is John O'Connor. I'm a family physician based in northern Alberta. For the last 20 years, Charlene, my wife, and myself have provided primary care service to mainly Aboriginal communities downstream of the tar sands. A few years ago, in the community of Fort Chippewa, a population of 1,100 people, in a very traditional Aboriginal community, I uncovered a burden of pathology that surprised me. And my biggest concern was the number of cancers in the community. I brought this to the attention of the authorities. Their reaction was very unexpected, and I'll talk about that later. The Cancer Board in the province of Alberta did a study of cancers in Fort Chip and confirmed a 30% higher rate of cancer, among them rare cancers. They suggested a comprehensive health study be undertaken. This didn't happen. In the meantime, and I have a pile of papers on the desk over there that represents a fraction of the peer-reviewed, respected, published scientific and independent studies that have been done since that reveal a burden of impact on the environment contrary to what the Canadian and Alberta governments are saying. This burden includes a sizable number of carcinogens that get into the food chain, into the water and into the air. These toxins have been linked with cancers and the types of cancer that occur in Fort Chip. This represents a public health crisis in this community. It seems, and over the years I've been interviewed and given talks at various functions, that the only reaction we get is when outside influence is brought to bear on Canada. I appeal to you to keep up the pressure. This is an ongoing tragedy. I'm just here as an advocate for my patients. I have absolutely no political agenda. I appreciate very much this opportunity. Thank you.
Thank you so much, Doctor. We're going to hear next from Dr. Stuart Batterman, a professor from the University of Michigan, who will tell us about his research, which found significantly higher levels of dangerous pollutants and carcinogens downwind from a tar sands refinery near Edmonton, Alberta.
Thank you very much. Good morning. My concern is with public health, both the environmental and occupational health. And facilities I'm looking at are downstream a bit from the extraction at Athabasca and Chippewa that Dr. O'Connor was just talking about. These facilities are very large scale. They release multiple pollutants from multiple sources. This leads us to a problem of cumulative impacts from the large scale development and the many chemicals. There's no doubt that the air and the environment has higher levels and sometimes much higher levels of contaminants than released from these petrochemical facilities. This is seen in rural areas, this is seen around refineries and upgraders, and it's seen in some of the urban areas as well, like East Edmonton. There are many gaps in the emission reporting. There are not all the chemicals that are released, and there's significant underestimation of these chemicals. Many of the chemicals are known health hazards that are associated with both acute and chronic effects like cancer, respiratory disease. And we've shown through some surveillance of cancers using 10 years of data that we have elevated levels of cancers like leukemia in adult males in areas where there are a significant fraction of upgraders and other petrochemical facilities. Of course, this data has the need to be more proactive because when we measure and assess cancer surveillance, it's too late. We need to be proactive and avoid these situations in the first place. Thank you.
Thank you, Doctor. Our next speaker, Hilton Kelley, is a community representative for Port Arthur. He will tell us about health problems that residents have experienced.
Thank you, Senator. Good evening, everyone. My name is Hilton Kelley, founding director of the Community Empower and Development Association located in Port Arthur, Texas, and I am a resident of Port Arthur, Texas. Southeast Texas has a large number of petroleum refining industries, and because of this fact, many citizens in Houston, Baytown, Orange, Beaumont, and Port Arthur, Texas are being severely impacted by pollution. Port Arthur, Texas is home to 3 major oil refineries, 4 chemical plants, a pet coke facility, and an international incineration facility. On a daily basis, the citizens of Port Arthur, Texas are exposed to dangerous toxins like benzene, which is a known carcinogen, hydrogen sulfide, 1,3-butadiene, sulfuric acid, heavy metals, carbon monoxide, and other volatile organic compounds. The Keystone XL pipeline is routed from Alberta, Canada, all the way to Port Arthur, Texas. And what it brings with it is more material called tar sands. This tar sand material is not good for our community. If this tar sand material is processed in the city of Port Arthur, Texas, and Houston, there will be a serious increase of various toxic material in the air that thousands must breathe in Southeast Texas. A disproportionate number of people in Port Arthur, Texas, and in the Houston Ship Channel area are presently suffering with cancer, respiratory issues, liver and kidney disease due to overexposure to high levels of oil and gas toxic fumes. Enough is enough. We do not need, neither do we want, tar sands material in our communities. We have a disproportionate number of our kids that have been stricken with cancer in our area. We have reporters that are constantly coming there, identifying these issues and talking with these residents. I know a family that have lost the mother, the daughter, and the grandmother. It's time for the onslaught to end. We have too many industries of this nature in our community, and tar sands is not welcome in the Port Arthur area. Thank you.
Thank you so much for your passion. Tom Shepard will tell us about a Chicago neighborhood that experienced billowing clouds of black grit blowing off the mountains of pet coke that are stored there.
Thank you, Senator. Good morning. My name is Tom Shepard. I'm a volunteer with a small nonprofit in Chicago called the Southeast Environmental Task Force. The Chicago southeast side sits near the confluence of 2 amazing water bodies, Lake Michigan and the Calumet River. These waterways were important for the region's industrial history, particularly steel. For generations, the landscape was marked by coal piles that fueled the factories, but in recent decades, the steel mills and 250,000 jobs they once supported have disappeared. But the big black piles have returned, only now they're made up of waste from the nearby oil refineries. We're getting mountains of petroleum coke, pet coke for short, along the Calumet River, in many places dangerously close to people's backyards, parks, and schools. We're paying a serious price for all of them. Particulate matter, this dusty soot blowing off these massive piles, some of them 5 stories tall, coats our homes, and we fear it also is coating our lungs. Neighbors have complained about sore throats, coughing, skin and eye irritations, and increased doctor visits. This past summer, winds kicked up clouds of pet coke dust so heavy that it sent children scurrying home from a nearby Little League facility, and families had to cancel picnics and other outdoor activities and run to the safety of their homes. The industry has heard our cries for relief, but they say that there's no real problem. But there are reams of studies making it clear that this particulate matter we are battling leads to increased asthma, respiratory disease, pulmonary diseases, and early death. Senator Durbin, my senator from Illinois, recently toured the area, and we're thankful he asked the CDC to study the issue so that people in my community can better understand the health threats that they're facing. The southeast side is a cautionary tale for the rest of the nation. The nearby BP refinery in Whiting, Indiana, which is about a mile from the Illinois border, has undergone a massive expansion to process the huge amounts of tar sand crude from Canada. This project is just completed and will triple the amount of pet coke that we're going to be getting. We know that we can expect more and more of this grimy waste blighting our community.
But as this tar sands production kicks up throughout the country, we fear that communities like Detroit and Ohio and Houston face the same blight. Harmful substances like this have no place in our homes, schools, businesses, and parks. Not on the southeast side of Chicago, and not in any community in the United States. We need Congress to act to protect America from this. I don't want to see others having to take on this fight.